Welcome back, everybody. It's a genetic disorder more common than cystic fibrosis, Down syndrome, or type 1 diabetes. Yet, experts say only 20% of patients know they have it. And if left untreated, it could be deadly. Familial hypercholesterolemia, God, I said it, is a form of high cholesterol. It's a genetic, I guess, a hereditary form of high cholesterol that affects families and also children. Now, joining me now is Dr. Jamie Underberg from NYU Langone Medical Center to talk about a new campaign to raise awareness about this treatable condition. Welcome to the program, Doc. I got to tell you, last week I teased the segment, and I say it's the most common genetic condition, blah, 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 and somebody asked me, so what is it? And of course I didn't know the topic just yet. I just teased the story, and I said, oh, it has to be probably cystic fibrosis or Fragile X or something like that. And now, of course, we learn it's cholesterol. So tell me about this condition. What is so unique about it?
Well, this is a genetic or inherited cholesterol disorder. People have very high cholesterol levels. It occurs in 1 in 500 people in the United States. 600,000 people in this country are affected with it. And again, that's more than you see type 1 diabetes or cystic fibrosis.
Right.
A typical cholesterol level for a patient with this disorder would be somewhere above 190 for the bad LDL cholesterol, and for a child or an adolescent, above 160. These are the numbers that you really start thinking about this disorder. It dramatically increases the risk of atherosclerosis, myocardial infarction, stroke, in these patients, sometimes to the level of 40 to almost 100 times greater at earlier age groups compared to people who don't have the condition. So it's important for people to know about it.
So let me then how, one of the things I guess that you want to bring awareness about this disease, which is, of course is very prevalent, is that diagnosis should be made and treatment should be implemented. I got that. The question always becomes, when should somebody check their cholesterol?
So we suggest that everyone should have their cholesterol screened by age 20.
Okay, by age 20, which is a little bit different than the AMA has recommended, or the American Academy of Internal Medicine has recommended.
These are recommendations from the National Lipid Association and our foundation. However, in children who have a family member that's been affected by either very high cholesterol or early heart disease, you can push that screening back in kids as early as age 2. So again, knowing cholesterol in adults impacts care and screening in children. So it's important to understand the risk to a family and not just to an individual, because this is a moving target for different people.
All right, so let's organize this thought, if we can, for people listening out there, because a lot of times, the problem, not the problem, always the controversy becomes this one, any kind of screening test that we do, we have always mixed messages every X amount of years, right?
Sure.
Do a mammogram at 35, no, do it at 40, no, do it at 55, no. Okay, so, and I think that one thing that you said is very important, is number one, family history.
Right.
That really nobody really understands how important it is.
Right. And oftentimes patients don't bring that up, and that's why this awareness is so key. Tell your physician that you have a family history.
Right. So if you have a family history, that being brother, sister, mom, and dad, right?
Or even grandparents,
or grandparents, okay? That if they have very high cholesterol and they've had struggling issues with cholesterol, then you should think that there might be a genetic component to your cholesterol.
Absolutely.
If you're a young adult, 20 years old, so you check your cholesterol at 20, it's okay, don't worry about it, right?
Well, that's up to your individual physician to decide.
Right, but it's not something that then you should repeat every year, because at the age of 20, if your cholesterol is normal, and otherwise you live a healthy lifestyle,
you probably don't have a genetic cholesterol disorder. You don't have genetic cholesterol,
right. So, but if you do pick it up and it's very high, then you have to check that out.
Yeah.
And of course, if there's been a diagnosis of this familial form of high cholesterol, then you got to check the children.
Absolutely. And one of the things that we also try to push practitioners to do is, when you find an adult with this abnormality, remind them that they need to talk to the pediatrician about this, because the pediatrician may or may not have asked the family members, the adults. So again, making the diagnosis in the adult implies treatment for the kids also, or at least screening for the kids, and it's very important. So the more information people have about the condition, the better it is for everyone. Sometimes we find patients they're diagnosed, say, early in adulthood, and they say, you know, I better get my parents screened. So screening can go in both directions. It can go downstream and it can go upstream.
Is there any specific risk factor for developing familial hyper?
Well, the single biggest risk factor is having a parent with the disorder, because
we haven't identified the genetic sequences or anything.
Well, we
like
actually know many of the abnormalities. There are almost 900 different genetic mutations that can cause this problem. There are really 4 basic ways you get the disorder, but ultimately the treatment is the same for all of them. So that information doesn't matter as much. You can screen people genetically, but the diagnosis is really a clinical one. It's high cholesterol, having a family member affected either with high cholesterol or early heart disease. And then in some cases you can actually find abnormalities on the physical exam suggestive of deposits of cholesterol. But you don't always find that in younger patients, so you can't rely on that as a way of making the diagnosis. So it's really a clinical diagnosis.
So let's go back a little bit, because we did tease this story as a children story a little bit. Let's assume there is a family history well documented. The child is tested. He's 6 years old, okay, and they do have a high cholesterol level. What do you do with that 6-year-old child?
Well, the first thing you want to do is you want to make sure that going forward you've minimized all of the risk factors that you can independent of cholesterol in that child. So you want to make sure, a low cholesterol diet improves cholesterol in everyone, including people with genetic cholesterol disorders. Exercise, make sure that they don't develop any negative habits down the road. That's all important. And then it comes down to how high the cholesterol is. And there's variability in these cholesterol levels. And for some children with very, very high cholesterol levels and early family history of atherosclerosis, pediatricians may opt for treatment early on. But again, screening is the key point to find these kids, because the earlier you treat this disorder, the less likely you will have a problem later in life. Cholesterol deposition, as you know, starts early.
Right.
And if we wait until later on, the cat's out of the bag, so to speak.
Right.
And so even though it's an asymptomatic condition, with this particular story, this genetic cholesterol disorder, because risk of disease is so much greater than people who don't have the condition, early intervention is really important.
I mean, listen, I had a patient of mine that had the disease. He did not know about it. 30 years old. He already has 4 stents put in his coronaries, and he's like 32, 33 years old.
We see this all the time.
So that's a common thing. So, you know, this is a reality. Let's talk a little bit about, and I don't want to segue here, but there's always a lot of resistance when you get somebody diagnosed, whether with familial high cholesterol levels or not, but just high cholesterol levels. There's always a lot of resistance to all of the statins.
Right.
You know, it's just oh, I don't want to take that. I heard stories, whatever. So, how much are there natural ways to reduce cholesterol? For instance, you know, you see all these omega oils that are being, different concoctions of omega oils that either come from Europe or Scandinavia or whatever. You see them in the Natural Healthy magazine. Lower your cholesterol by this and by that, or certain kinds of of foods and things like that. But how much can you lower your cholesterol with natural products?
So there have been a couple of studies looking at a potpourri of all of these things together. One of them is called the portfolio diet. And when you intervene as best you can with everything, you do about as well as a low dose of a mildly potent statin. So in patients such as the ones we're talking about, it's unlikely that it's going to do much for them. It'll bring the cholesterol down a little bit, but not anywhere near where these patients need it. For some patients, maybe intensive intervention with non-pharmacologic tools like we're talking about may bring them right over the edge. But for the patients we're talking about, based on what we know, it's just a drop in the bucket. It doesn't mean don't do it.
Right.
It just because it may minimize what you have to do with everything else.
Right.
I never say no, but realistically, to tell a patient that they could accomplish that,
their LDL is going to go from 190 to 100. It's not realistic.
It's like saying you may make it across the country on one tank of gas, but it's unlikely you're going to get there.
Right. Now, of course, so if because people listening out there say, okay, what are the symptoms of high cholesterol?
Well, the problem is in the beginning there are no symptoms.
Zero. No symptoms.
Absolutely. And
you don't feel a thing.
And it's not until you have that heart attack or stroke.
Right.
And for many people, the first symptom is the last symptom.
Right. And that's the whole issue with cholesterol. You don't. There's no symptoms. You don't cough. You don't gain weight. Your hair doesn't fall off. You basically have a heart attack, chest pain. You know, lose consciousness. You stop breathing, and you die. And that's basically the story. All right. Tell me a little bit about the campaign that you're doing.
All right. So the foundation of the National Lipid Association has an awareness campaign. Familial hyperlipidemia, it's relative. Know your family history.
Right.
We've got a great website. It's learnyourlipids.com. Patients can go to this website. They can find out about the disorder. They can find out about the risks. They can find out about the treatments. They can find specialists in their area of the country who deal in these disorders. And it is an area where if you have this condition, you probably should be seeing someone who's a specialist and understands all the nuances of managing a disease like this. So it's a great campaign. I think it's a great program, and hopefully we can get awareness out there about this disease state that, again, is the most common treatable genetic inherited disorder that we have in this country and worldwide.
Right.
And I think that's something that can't go unnoticed.
You know, and I can begin to tell you, and this is something that the doc is saying. Nowadays, medicine is relying tremendously on family history, probably more than we ever did before, probably more than when you and I went to med school, because now we understand all of the, look at the Genome Project revealed to us so many things that we had to learn about inherited patterns of disease, that now, yes, if you look back at your mom and dad's history or your sister's history and your brother's history, you say, oh, I can learn a lot about what could be in store for me. And that's so valuable to doctors, and that's exactly what this campaign is talking about.
Well, I'm sure you know one of the most common reasons or things that prompt someone to come in and see you is they're a year or two away from that date when dad or mom had their first heart attack and stroke. So they know the importance of family history. Patients know this, and that's why it's so important to incorporate it into the diagnosis of this disorder.
Okay. And finally, tell me some of the recommendations coming out for treating this familial disease.
Well, again, the recommendation is if someone has this condition, they need to get their LDL bad cholesterol down. The recommendations are to lower that LDL cholesterol 50%. In patients who have multiple risk factors, say they're a smoker or they've already had a heart attack or a stroke, even further reductions is probably indicated. And so, again, aggressive cholesterol lowering is the key, and that's the way we treat this condition.
And I notice that you keep referring to LDL,
yes,
the low-density lipid type of cholesterol, right, which is really the bad cholesterol. You don't necessarily focus too much on total cholesterol.
No, we really look at the LDL cholesterol.
Hey, listen for people out there.
And in fact, many of these patients may have normal or high levels of the good cholesterol, and that should not mean that they don't get their LDL treated.
Right, right. Okay. Well, thank you so much. This is a great campaign. Log on to the website to get more information, because I think this is a very important disease and a type of disease that you can prevent the long-term consequences of coronary obstruction and plaques in your heart and your neck. All right. Thank you very much.
Thank you very much.